Hey, Dr. Vicki here. So let's talk about a motor vehicle accident patient that came in, and it was a month out, numbness and tingling in the hands, sore neck, sore shoulders, headaches, a lot of issues with the eyes. And so we had to kind of break it down and try to figure out, number one, was it the lack of mobility in the neck and lack of muscle support in the neck and shoulder, because those two things are related. I've talked about that in my videos before. Whenever you have a neck issue, you have to look at the shoulder, and when you have a shoulder issue, you have to look at the neck. And so the flexion extension injury that she sustained, there was a lot of inflammatory response in the middle of the neck. She had some anterior vertebrae, which is basically where one vertebrae moves a little bit in front of the other, and it jams up a lot of the joint movement. So she had that going on, and it was really causing some headaches behind her eyes. So when there's a headache behind your eyes, you have to look at if there's a vascular issue. So you're looking at blood flow on the right side versus the left side and seeing what is going on. And she happened to have her pulse on one side, and her blood flow on one side was way down compared to the other side. So we wanted to boost some oxygen, and I thought it was probably because of a shoulder being forward on one side, and it really disrupted the subclavian artery supply underneath the clavicle, because the clavicles get pushed into the sternum with a motor vehicle accident if you're hanging onto the steering wheel. So we worked on the soft tissue aspect and looked at a bunch of other different things that happened that she was having going on prior to the accident, but then after a month, those problems became worse. So if this sounds like you, give Sauter Chiropractic a call. We're located in the Denver area at 303-385-3432. I have 2 offices, and then I also do animal chiropractic. You can go to sauterchiropractic.com. I also have sauterdogchiropractic.com, and you can go to either one of those. And again, my number is 303-385-3432. Have a great day.